Hi guys, and welcome to Direct Pressure. In this video we're going to talk about what is direct pressure, when to use it, and how to apply different bandages. Okay, let's dive right in. Okay, so what is direct pressure and what is indirect pressure? Direct pressure is when we apply a bandage directly on the bleeding spot, okay? And we put pressure on it. Indirect pressure is when we put pressure above the bleeding spot to cut the bloodstream to the bleeding spot, and that way stop the bleeding. We would always prefer to use direct pressure because it has a lot less complications. In the next video we're going to talk about tourniquets and about indirect pressure, but for now let's focus on this little thing and learn how to apply different bandages. Okay guys, now let's learn how to place a personal bandage. Now the way that we do it is we want to place it directly above the injury, as we learned. And now, after we release it, we have two really long strings. Now, what we want to do is we want to take the strings and have them on top. So I'm going to do it carefully so the bandage won't move from its place. And now I have them on top. Now that I have the strings on top, what I want to do is I want to take them again to the bottom. And the reason why I do this is I want the bandage to be able to stay in place while I bandage it. So I do this one time and then I take them on top again, and now I can start bandaging. So the first thing I want to do is I have one string in the front and I have one string in the back, and I want them to switch places. So I will take the string that is in the front and I will make sure that it returns to the front. And what you see is I now have this twist in the middle. Now what I want to do is I want to pull on the sides so it will put as much pressure as I can. Now I'm gonna hold this with my thumb so it will not release, and I will take the string that we have in the front and I will wrap it around over one of the sides until I have a little bit of string on top. And now we'll do this with the same with the other string. I will wrap it around the side until I have a little bit of string on top. And now all I want to do is I want to take these two little strings and tie them really strongly together, and that's it. And that's how you use a personal bandage. As you can see now, it doesn't move and it has some pressure on him. After you place it, I really recommend checking his pulse to make sure you didn't place it too strongly. You do want to place it strong so it will stop the bleeding, but you don't want to completely stop his blood flow. This is not a tourniquet. Okay, so what do we do if we place this but it's not strong enough? We can add more pressure. The way that we can add more pressure is using a triangle bandage. The way we do this is we take a triangle. This is why it's called a triangle, by the way. So we take a triangle, we wrap it around so it will be like a rope, and we tie a big knot in the middle. Now, as you can see, the knot will usually have a flat side and a pointy side. What we want to do is we want to take the pointy side and put it directly above the injury. And we want to make sure that we pull so there is going to be pressure. And then we just want to make sure that we improvise somehow that we tie on top of it, that it will create more pressure. And after we tie it exactly above it, now we have increased the amount of pressure that we put on the bandage. And this is how you use a personal bandage as well as a triangle to increase the pressure. Okay guys, now let's talk about the Israeli bandage. Now this is probably the best direct pressure bandage that we can get. Because of a few reasons. It has a clotting agent, which means it helps the blood clot faster, and we don't need a triangle to increase the pressure that it creates. So it's a very good bandage overall. Now the way that we use it is we open it and we take the sterile side and we put it directly on the injury. And now what we want to do is we just want to wrap it around. And we want to, and you see there's like a plastic device on top of it. We want to take the bandage and insert it inside. Like this, once. and twice. Make sure that you yank it so it will create pressure. Perfect. And now after we put it there inside twice, on the third time, what we're gonna do is we're gonna switch, switch to the other direction. And as you can see, this is exactly the same as the triangle we used earlier. Perfect. And now, after we did that, all we wanna do is just draw an X with our bandage. So we do one above, one below, one above, one below. I personally like to add a few in the middle as well, just to make sure that there's enough pressure. And then above, and then below. And now we have just a tiny bit of bandage left, and we just wanna continue to use it until we're left with just this little thing. And we just clip it to one of the wrappings that we did. So here I go. And now I just wanna clip it. Perfect. And as you can see, this is firmly in place. This cannot move. You do need to check his pulse to make sure that he has a pulse and we didn't put it way too strongly. Yeah, I can feel that he has a pulse and he can move in his fingers, right? Mm-hmm. Perfect. So as you can see, this is how you place the Israeli bandage. Okay guys, now let's learn how to use the Israeli bandage to bandage the head. So what we want to do is we want to open up the bandage and have the sterile side and put it exactly on top of the injury. And then what we want to do is we want to start and bandaging it. In the first loop, I would recommend doing it slowly so it will not fall out of place, and we want to hold it together. And we want to go inside of the plastic thing. Okay, now after we have one loop, the second loop we can already put some more pressure and make sure that we're applying pressure to the injury. Now, I don't recommend to go to the other side like this, because this is the head and we do want to apply pressure, but we don't want to apply too much. Now, after you did a couple of loops like this, what we want to do now is, can you move your head? Yeah, perfect. Okay, so after you did a couple of loops like that, what you want to do now is you want to do an L shape. So you're going to hold it with your hand and you're going to push it to the side. And now you're going to try and cut it in place. So again, you're going to hold it and you're going to make sure you're going on his forehead, and you're going to do it weakly to capture it in place. And now you're just trying to hold it together in place. When you're finished, you have the clip at the end, and you just want to clip to the side like we did last time. So above and below. Perfect. And that is how we use the Israeli bandage to bandage the head. Okay, and that is it for direct pressure. Now remember, direct pressure is when we put pressure directly on our injury, and we can do this with anything. So we can obviously use bandages, we can improvise, and we can even take a sterile gauze pad and just press it really strongly with our hand to make sure the blood will clot and stop the bleeding. Now we would always prefer to use direct pressure. However, in some situations we will need to use tourniquets. And in the next video, we'll learn exactly those situations. I hope you guys enjoyed, and I'll see you in the next video. Bye guys!